So these guidelines were actually displayed in the group as well. So I'll just go through for the benefit of the students again. I hope that all of you all have already downloaded the Kahoot app. So it's better that there's a Kahoot app which is running in one device and the Zoom meeting is going on in another device, so that it'll be easier for you to participate in the quiz separately rather than having two different tabs in the same device. Okay. So basically, I think Kahoot has a login ID and a PIN. So it's preferable that you use your phone number as your nickname when you're joining, and that will be your ID. And the Kahoot PIN will be shared by Shivam during this process once we are just about to start the quiz. And also remember, there is no negative marking. It's going to be 20 questions that will be displayed. There's no negative marking. So you need to be answering the question correctly, at the same time answering it as quick as you can. Because basically the Kahoot app records your correct response, and at the same time as to how much duration you're going to take to get to that answer. And the question is going to be, or you basically have around 20 seconds to answer the question after the question is being displayed and read out on the screen. So at the end of 20 questions, so basically depending on the score each one gets, we will be having top 4 winners who will be split into 2 groups, and those people will be going to the zonal round. Is that right, sir?
Yeah,
that will be top 4 winners, right?
You choose the 4 winners, and then whatever way may be slip system, you can format into 2 teams, right?
Okay.
Dr. Rajapriya.
Hi, ma'am.
Hi, good evening.
Good evening, ma'am. So this is how it will be, right? Because Kahoot platform, Shivam, I told you to find out whether it can be a team also, no?
Yeah, sir, I am working on the same. I'll get back to you regarding the same.
Yeah, because the next zonal will be team wise, right? So 2 participants in 1 team.
Okay.
Just try to find out how you can organize that one, right?
Done, sir.
Okay.
So, Shivam, do we get a score at the end of each question, or how is it? Do we?
We get a score on the screen at the end of every question. So who is on the top, and everything will be displayed, right?
Okay.
Yeah, this is the pin. Now,
Okay.
you can start.
Ma'am, Kahoot is not getting downloaded. 2 minutes.
Yeah.
Okay. Well, let other people join. Dr. Rajapriya, you can introduce.
Sir, I'm coming in and out, sir.
Yeah, ma'am, not a problem.
Is Deepa or...
Dr. Rajapriya,
Deepa is already there, ma'am. Dr. Deepa is already there.
Deepa is the star for the day, sir.
Knows is a South Zone coordinator, right? So she has the main role here. And Dr. Chitra is ma'am is there, right?
And actually, there are many quizzes happening in and around that. Shivam is actually quite confused on which day, which state level quiz
I understand, because everybody was waiting for the last month to, conduct, because other chapters like North has almost completed its zone.
Yeah. We'll also be done, sir. By 22nd October, we will be done.
Yeah, so this was 18, 19, 20, 21. This was slightly a busy schedule, Everybody was on these dates. So,
and there are a lot of festivals also going on.
We have festivals.
Correct.
Yeah, everybody, I don't understand. So this is everywhere. So 23 participants have joined, 25, good.
There were actually, I think, many who had registered.
Dr. Chitra ma'am, what I was trying to tell was, the thought was that we have kept the age also as of less than 45. It's not only the students who are supposed to participate. It's the young gynecologists, who want to go into infertility, or so even those people should get a chance to participate, and so that was the thought. Otherwise, the initial thought was only students will participate. But then I said, no, let it be age-based, because students, by the time they finish their, you finish your PG or fellowship, you are already that age. So I said, let 45 be the cutoff point. So anybody who is less than 45 can participate.
That's a great thought.
even our girls would have participated by it, but I forced them to become the coordinators because all my EC members are less than 45.
It's good. Madam, if everything goes well, so probably from next year, we'll have two things. One will be for seniors and one will be for juniors also. So
Correct.
less than
That's it.
45 and more than 45.
Yes, yes, sir.
If things are under my control next time also. So this is how we plan to do, right? So let's see how things move on. It all depends how successful the whole program goes on. I wish everything is going on right at the moment, but let's see how the finals and semi-finals go. So
So,
we
sir, will there be a team getting selected directly from the winners of this monthly quiz as well, or how many teams would
yes,
that?
what we have done is say like we have 7 months, no? So we are taking top three from every month. So 21 people are there.
Hmm.
So
Okay.
say 21 or 22, and then we'll have some central team also, probably two teams from center also. So it
Okay.
will be 21 in plus four, say 25 or 26. So we'll somehow allocate them team members each, no? So maybe by draw of lots or whatever. So we'll
Hmm.
have those teams. So that is a better part because from the lot, one can be from south and one can be from north. It doesn't matter to me.
Correct.
So
Correct.
that will be another. I
So,
mean,
would they be bypassing the zonal round and going to the semi?
yeah, they are set directly for semi-finals.
Okay. Okay.
So
Okay.
everybody will be from the zones also and from the direct also. They will be participating in semi-finals. And from semi-finals, we'll pick up 6 teams who will be for the
Go
final.
to the
Final will be a bigger. We are trying for a bigger show for the semi-final also. But let's see how much place we really get in for division. We are just trying to get a bigger platform there also to complete hall, a bigger hall. And because those will be physical, and even the physical means even those will be at Kahoot only, but they will be present there, right? This is how it
correct.
is. Because now Kahoot is a good platform. Otherwise, this is right.
Sir, it's
And then
7:10
let's
now. Should we start?
Yes, I think.
Chitra ma'am, your words.
Yeah, all the best, dear participants. I think this is a great opportunity for you to get exposure to all the questions, good revision, and hopefully we'll see you in the fertivation, conference, because there is some conference benefits also. So we'll see how things go. But all the best. Do very well.
Some questions in chat box, Shilpa.
I
There
think
is some they have difficulty in
only
joining.
pin is shown, nickname isn't displayed. So the nickname is basically going to be your phone number.
Mobile number. Yeah.
Is there any other doubts for login?
It's showing being kicked out of game. Who is this now?
You can try again.
Trying to-
Try again. Nobody has kicked
Rohini.
you out.
I think probably
Somebody
they have
named
just
Rohini.
logged out of.
Yeah, she got it. Nobody is kicking anybody out, please.
So if there are no questions from the students with regards to the login and any other technical issues, then we will probably be.
There are actually
Ranjana,
42 people as a participants, but those who joined Kahoot is only less than 30.
anybody who's having difficulty, 29. Anybody who's having difficulty, please put in the chat box. We'll be able to sort it out.
Didn't get.
Rajana, please put your nickname as your telephone number. Where is option of?
There is option of nickname.
So as soon as in the app, if you join it, it's asking the pin. Then it's asking the nickname. Correct?
Right, right. Rajna, you can quit and then join again with your telephone number. So Shilpa, tell Dr. Rajna.
Is everybody on the right track, or is there still any doubt? Please leave a message on the chat box.
Yeah, another 2 minutes and then Shivam will start.
Please let us know if any confusion is there.
Dr. Shilpa, how many people are on Zoom?
42,
Totally
Dr.
42. In that, I think 6 of us are faculty, and I think 1, 2, 3.
And there are only 28 people who have joined total.
Hmm.
Maybe other must be more than 45.
So the others just want to listen to the questions and don't want to participate.
Maybe older than 45. I just want to watch the show.
Yeah.
No, ma'am. Nobody is older than 45. All are just young students, postgraduates, senior residents, and fellows.
We have a lot of fellows. We
Okay.
have too many fellows everywhere.
Shivam, can you please unmute Dr. Saubernika? She's also one of the quiz coordinator.
So, ma'am.
Thank you. Thank you.
Okay, Shivam, you can start. Dr. Shilpa, you can start. It's already 7:15.
Yes, okay. Okay, so please remember, get the question right and at the same time answer as fast as you can. Okay, and there'll be 20 seconds to answer each question. Okay, so question number 1, what would be the correct order of events during fertilization? Digestion of zona pellucida by acrosomal enzymes. Number 2 is sperm bypasses corona radiata. Number 3, cortical granules release enzymes. And number 4, sperm binding with white line membrane. Which of the following statements is true regarding long-acting recombinant FSH or chorefolitropin alpha? Shivam, just a second.
Next question.
Can you just keep it on hold just for a second?
After this question, I can hold.
Yeah. So semen analysis of a 35-year-old shows more than 1 into 10 power 6 round cells per ml on microscopy. Next best step is? Shivam?
Yes, ma'am.
Yeah. Can we start the timer after the question is read?
No, ma'am. Actually, once you announce the question, no, so they will be
Okay.
displayed on the screen also, on their screen also, the participant screen.
Okay.
So they will
So
understand,
this
yeah.
20 second is inclusive of the question.
Correct.
Okay. The above condition complicates fertility treatment by following mechanisms except. So that's a picture of a HSG. Is it physically flushing the embryo, inflammatory fluid, reduced HOXA gene expression, or increased integrin? Which of the following is not a laboratory KPI? Sperm motility post preparation for IVF, successful biopsy rate, proportion of M2 oocytes at ICSI, or ICSI damage rate. Spermacrosome contains following enzymes except hyaluronidase, amylase, neuraminidase, or phospholipase. The first human IVF pregnancy was reported by Robert Edwards, Patrick Streptow, Pincus and Ensman, Howard and Georgiana Seeger-Jones, or Calwood and John Leeton. Which type of molecules are hybridized in gene expression microarrays? Complementary DNA with fluorophores, complementary RNA with chemiluminescence, complementary RNA or complementary DNA. Water seeding and cryopreservation. So you have 4 options. Freezing protocol without cryoprotectants. It's controlled induction of extracellular ice crystal formation. Is it gradual exposure to cryoprotectants or induction of formation of intracellular ice crystals? So this is an ROC graph which will be displaced. Please identify which is the best diagnostic test and the poorest test for male infertility. So panel A has concentration, motility, and morphology, and panel B has DFI. Most common cause of Down syndrome is due to non-disjunction during first meiotic division, non-disjunction during second division. Is it mitotic errors or is it Robertsonian translocation? Dr. Saubanika, you can take the rest of the question.
Yeah.
Question number 12. Regarding LH surge, identify the false statement. Resumption of meiosis in the oocyte, decrease in CGMP levels, activation of oocyte maturation inhibitor, all of the above are true. Question number 13. Most common reason for high progesterone levels early in the cycle. incomplete luteolysis, concomitant DHEA administration, undiagnosed pregnancy, exogenous progesterone administration in luteal phase of previous cycle. Next is question number 14. Osmolarity of culture media used in IVF. 189 to 210, 220, 255 to 295, 300 to 350, 150 to 180 milliosmol per liter. Let's go to question number 15. "18-year girl with primary amenorrhea is diagnosed with Sway's syndrome. Identify the false statement." Exhibit normal growth and intellectual ability. No comorbid medical conditions. Pregnancy can be achieved through donor egg program. Gonadectomy can be delayed till puberty. Pubertal development is complete. Question number 16. Serum progesterone levels are dash until the start of LH surge in natural cycle. Less than 2 nanogram, less than 1 nanogram, less than 0.5 nanogram, less than 0.1 nanogram per ml. Next is question number 17. Which two cell types may form the monolayer used in co-culture technique? Embryo tissue and prophoectoderm, tissue of female genital tract and embryo tissue, animal and vegetal tissue, epithelial tissue and tissue of female genital tract. Moving on to question number 18. Reason for appearance of fragments in pre-implantation embryos. Results from in vitro culture, reflection of apoptosis phenomena, defective position of meiotic spindle during cleavage, occurs in multinucleated embryos. Question number 19. Identify the true statement regarding benchtop incubators. Oxygen sensor used is infrared sensor, less power consumption. Return of PO2 to low levels is gradual after opening the incubator. Higher risk of contamination by bacteria and fungus. Last question. Question number 20. Image of mature oocyte is depicted. Identify the abnormality. It's an SCR, large vacuole, refractile body, organelle clustering. And we have come to the end of the session. I congratulate all the participants over here. Let's see the results.
It's actually top 4 winners. I think 3 are displayed. We should be having the fourth one also, Shivam. Yeah.
Congratulations, everyone who is won. And whosoever was number one can please, put on your videos and your audio. You can.
You can introduce yourself
Yeah.
because we don't know. We only know you by numbers as of now.
Dr. Shilpa, please note their names and
Yes, sir.
numbers
Yes, yes.
that we know, right?
Yes, sir. So the person in number one position, can you please unmute yourself and introduce? Can you just display that again, Shivam? In case the participants haven't seen that.
No, they know it will come in their
It'll come in
Kahoot.
there, this thing, right? Yeah.
Yeah, this is it.
9632.
You can
First
click,
is 96321.
Dr. Subhash, you
572.
can click the picture and you can remember the telephone
Yeah.
numbers.
Yeah.
And the fourth winner also needs to be announced.
Yes,
So,
yes.
that's the
9494
fourth
548941.
okay.
Please, hello. Please put on your videos and introduce yourselves. Number one, 9632157251. Shivam, please stop sharing.
Hello,
Hi.
sir.
Yes.
Hello, sir.
Dr.
Good evening.
Chaitanya, right?
Yes, doctor.
Sir, I am Dr. Chaitanya. I am a first year MCH resident in KMC Manipal.
Good.
Congratulations, Dr. Chaitanya.
Congratulations, Chaitanya.
Congratulations.
Number one, right? You are the winner.
Thank you, sir. Thank you, ma'am.
Chaitanya, you are first.
Yes, sir.
Okay.
Good. Congratulations.
And the second one, unmute yourself and introduce.
Someone has messaged that she is a fourth
I did not realize it is Karnataka.
Karnataka chapter.
Your fourth is eligible for the next round.
I am from Telangana. Okay. So there's one participant who has basically participated in this quiz, but is from
No,
Telangana.
if fourth one is from Telangana, then take the fifth one.
Yeah. Okay. So I think we have a display of the fifth winner as well, right? Yeah. So the second, third, and fifth winner are yet to introduce themselves.
Good evening, teachers. I'm Dr. Darshan. So I'm placed third. I've
Okay.
received my FNB from Ruby Hall, Pune. I'm
Okay.
working in Indra IVF currently.
Okay. Fine. So Indra IVF from which
You're from
place?
Karnataka.
Yes, Bangalore.
In Bangalore. Okay.
Congratulations, Darshan.
Thank you.
Unmute yourself, Shivangi.
You are unmute yourself.
Good evening, ma'am and sir. I am Dr. Shivangi and I am MCH first year resident in KMC Manipal.
So you are
Okay, so
third.
two of them from KMC
Two of them are
Manipal.
from
You are
Manipal.
second, Shivangi, is it?
Yes, sir.
Okay. Congratulations.
Thank you, sir.
And about the fifth winner? So fourth winner, you can anyway, I think, introduce yourself, but unfortunately, I think you cannot be participating through Karnataka.
Parvati Devi.
Okay.
Yes, ma'am.
Okay. You're from which place? You're doing your
Hyderabad, ma'am.
fellowship? Okay. So you're doing your fellowship or
I have done MCH, ma'am.
you've done your MCH? Okay.
Parvati, which MCH? MCH in what?
MCH in reproductive medicine and surgery, sir.
That is from Manipal only, is it?
No, I did from Jaipur, sir.
Which college?
Mahatma Gandhi Medical College, Jaipur.
Right. They are providing MCH also.
Yes, sir.
So that goes through your the national board examination, is it?
Yes, sir. Through NEET SS. Yes, sir.
Good.
Thank you.
Okay. Congratulations.
Congratulations.
Actually, I did mistake. I didn't realize. Sorry.
No problem.
That's fine.
Okay.
The Telangana chapter of quiz is yet to be conducted, is it?
Yes, ma'am. I just saw the heading and in hurry. Today is Friday, so
Okay. Never mind.
No worries. It's a good revision exercise.
Yeah.
So it's good.
Parvati, you can participate in direct quiz also, right?
Yes, sir. Yes. Actually, I thought this is that monthly quiz.
Okay.
It is on 25th. It is on 25th and it is imaging in infertility, right?
Yes. Thank you.
It is 25th only.
Thank you.
And now
The
we have
fifth
to
winner?
put the fifth winner.
Good evening, everybody. I am Dr. Prajna. I
Okay.
am doing my first year my fellowship in Enopoya Medical College, Mangalore.
MCH, is it?
No, fellowship
Okay. Okay.
Okay.
in
Okay.
reproductive medicine.
FNB. Is it FNB or something else?
It's
Is
a
is it in
fellowship in
1 year
reproductive medicine.
If it is an
institutional
FRM,
fellowship?
sir, it's an FRM. It's the local
FRM.
university fellowship.
Yeah.
RGH is affiliated?
No, it's
It's a
Enopoya
1
deemed
year.
to be university.
Okay.
Enopoya
So it's
University.
an institutional, okay, fellowship.
Yes.
Okay.
Yes.
Okay. Congratulations.
Yeah, thank you.
Congratulations, Pragna.
Yeah,
All
thank you.
the best. And people who could not make it this time, please participate in your monthly quiz, right? So that's another way you can get to the next rounds.
Good
We'll
evening.
do
There's
that
a query
monthly quiz.
asking where can we get link for the monthly quiz?
We will share in the group, yeah.
Yes,
We will share.
we share you and Dr. Shilpa, and then you can circulate in that your group, right?
Yes.
Yeah.
And
yes,
also, I think
we'll
all the
do that.
participants, please register for the IFS. It's a lifelong membership. So I think when you get registered, you are automatically added into the central IFS group and the state group. So you
Yeah.
keep getting updates. I think there are wonderful webinars also that are happening and being recorded, wherein you can have an offline access to them as well. So, and there are wonderful journal clubs also happening twice a month. So you can, I think, use on that opportunity as well.
Very good.
And please register yourself for Fertivision. Please send your abstracts so that we'll have a good session.
Geeta Khanna ma'am, please, good evening. Please unmute yourself and video. Geeta Khanna ma'am. Anyway, okay, ji. Thank you so much. Thank you, everyone.
Thank you so much, sir.
Thank
your
Thank you,
time.
sir.
Thank you.
Thank you all for the
And
participation.
Dr. Swarnika, please send these names to either to me or to Dr. Parul, whatever, right?
Sure, sure, sir.
Please send it
Yeah,
to the
I'll do that. Yeah.
Thank you so much. Thank
Okay,
you.
have a nice day.
Thank
Bye-bye.
you. Take care.
Thank you, sir.
Thank you,
Shilpa,
everybody.
and thank you,
Thank you,
Savan.
Dr.
Thank you so
Thank
much,
you,
ma'am.
Shilpa, everyone. Thank you, Dr. Chitra.
Thank you, sir.